Top 25 paramedic interview questions and answers. Paramedics play a critical role in emergency medical services, providing life-saving care under intense pressure. This profession requires strong clinical skills, emotional resilience, quick decision-making, teamwork, and compassion. Interviewers assess not only medical knowledge, but also communication skills, ethics, stress management, and professionalism. Preparing structured, consistent answers helps demonstrate readiness for real-world emergencies. Below are the top 25 paramedic interview questions and answers, with each answer written at approximately 90 words, ensuring equal depth and consistency across all questions to help you prepare confidently for your interview. 1. Why did you choose a career as a paramedic? I chose a career as a paramedic because I am passionate about helping people during their most critical moments. I find fulfillment in providing immediate medical care and making quick decisions that can save lives. The role allows me to combine medical knowledge with teamwork and problem-solving in dynamic environments. I am motivated by the responsibility and trust placed in paramedics. This profession also offers continuous learning opportunities, which helps me grow both personally and professionally. 2. What are the main responsibilities of a paramedic? A paramedic's responsibilities include assessing patients, providing emergency medical treatment, administering medications, and transporting patients safely to medical facilities. Paramedics must communicate effectively with patients, families, and hospital staff. They also document care accurately and follow protocols. Ensuring scene safety, operating emergency vehicles, and working collaboratively with other responders are essential. The role requires clinical expertise, quick judgment, and professionalism to deliver high-quality pre-hospital care in stressful situations. 3. How do you handle high-pressure emergency situations? I handle high-pressure situations by staying calm, focused, and following established protocols. I assess the scene quickly, prioritize patient needs, and make decisions based on training and evidence. Clear communication with team members helps ensure coordinated care. I manage stress by concentrating on one task at a time and trusting my skills. Remaining composed under pressure allows me to provide safe, effective care and reassure patients during emergencies. 4. How do you assess a patient on scene? I begin with scene safety and a primary survey, focusing on airway, breathing, and circulation. I assess vital signs, level of consciousness, and immediate life threats. Once stabilized, I perform a secondary assessment, including medical history and physical examination. I gather information from the patient or bystanders and continuously reassess the patient's condition. A systematic approach ensures accurate assessment and appropriate treatment decisions. 5. How do you deal with difficult or uncooperative patients? I handle difficult patients by remaining calm, respectful, and empathetic. I listen actively to understand their concerns and explain procedures clearly to reduce anxiety. Maintaining professionalism helps de-escalate tense situations. If safety is a concern, I follow protocols and involve law enforcement if necessary. Respectful communication and patience often help gain cooperation, allowing me to provide effective care while ensuring safety for everyone involved. 6. How do you ensure patient safety during transport? I ensure patient safety by properly securing the patient, monitoring vital signs continuously, and maintaining clear communication with my partner. I adjust treatment as needed during transport and prepare for potential complications. Safe driving practices and adherence to protocols are essential. I also provide reassurance to the patient to reduce stress. Continuous monitoring and preparedness ensure a safe transfer of care to the receiving medical facility. 7. How do you handle emotionally traumatic situations? I handle emotionally traumatic situations by focusing on my professional role and providing compassionate care. After incidents, I reflect on the experience and use healthy coping strategies such as peer support or debriefing. I understand the importance of mental health and seek support when needed. Maintaining emotional resilience helps me continue performing effectively while ensuring long-term well-being and preventing burnout. 8. How do you work as part of a team? Teamwork is essential in emergency medical services. I communicate clearly, respect each team member's role, and support others when needed. I remain adaptable and follow leadership when appropriate. Effective teamwork improves patient outcomes and ensures efficient operations. I value collaboration and believe shared responsibility and trust are key to handling emergencies safely and successfully. 9. How do you handle medication administration? I handle medication administration by following protocols, verifying patient information, and calculating correct dosages carefully. I double-check medications and routes of administration before delivery. Monitoring for adverse reactions is essential. Accurate documentation and clear communication with medical control ensure patient safety. Attention to detail and adherence to guidelines help prevent errors and ensure effective treatment. 10. How do you stay current with medical knowledge and skills? I stay current by attending continuing education courses, participating in training sessions, and reviewing updated protocols. I also engage in scenario-based practice and review medical literature. Staying informed ensures I provide evidence-based care. Continuous learning is essential in emergency medicine due to evolving treatments and technologies. 11. How do you manage time during multiple emergencies? I manage time during multiple emergencies by applying triage principles and prioritizing patients based on severity of their condition. I stay organized, focused, and communicate clearly with my team to coordinate care efficiently. Delegating tasks and following protocols helps ensure no critical steps are missed. I reassess situations continuously as conditions change. Effective time management allows me to provide timely, high-quality care while maintaining safety and ensuring resources are used appropriately in high-demand situations. 12. How do you ensure accurate documentation? I ensure accurate documentation by recording patient assessments, treatments, medications, and responses as soon as possible after care is provided. I use clear, objective, and factual language while following established documentation standards. Accuracy is important for continuity of care, legal protection, and quality improvement. I double-check entries for completeness and clarity. Proper documentation ensures that receiving medical staff have reliable information and that patient care decisions are well supported. 13. How do you communicate with patients and families? I communicate with patients and families using clear, calm, and compassionate language. I explain medical procedures in a way they can understand and listen carefully to their concerns. Empathy and reassurance help reduce anxiety during stressful situations. I remain honest while being respectful and supportive. Effective communication builds trust, improves cooperation, and ensures patients and families feel informed and cared for throughout the emergency response and transport process. 14. How do you handle ethical dilemmas in emergency care? I handle ethical dilemmas by following medical ethics, legal guidelines, and organizational protocols. I prioritize patient safety, autonomy, and best interests while maintaining professionalism. When situations are complex or unclear, I consult medical control or supervisor for guidance. Clear documentation and communication are essential. Ethical decision-making requires balancing compassion, responsibility, and professional standards to ensure patients receive appropriate and respectful care in challenging circumstances. 15. What steps do you take to ensure personal safety? I ensure personal safety by assessing scene hazards before approaching, using appropriate personal protective equipment, and remaining aware of my surroundings. I follow safety protocols and coordinate with law enforcement or fire services when needed. Protecting myself and my team is essential to providing effective patient care. By maintaining situational awareness and following training guidelines, I reduce risks and ensure that emergency responses are conducted safely and efficiently. 16. How do you handle fatigue during long shifts? I manage fatigue by maintaining healthy sleep habits, staying hydrated, and eating balanced meals. I use breaks effectively to rest and reset mentally. I recognize early signs of fatigue and adjust my pace to maintain focus and safety. Communication with supervisors is important if fatigue affects performance. Managing fatigue responsibly ensures I remain alert, make sound decisions, and continue providing safe, high-quality care throughout long or demanding shifts. 17. How do you handle pediatric emergencies? I handle pediatric emergencies by remaining calm, patient, and attentive to both the child and their caregivers. I adjust communication to the child's age and explain procedures clearly to reduce fear. Accurate weight-based medication, dosing, and careful assessment are essential. I provide reassurance and maintain a supportive environment. Pediatric emergencies can be emotionally challenging, but compassion, clinical precision, and teamwork help ensure safe and effective care. 18. How do you respond to mass casualty incidents? I respond to mass casualty incidents by following established incident command and triage systems. I ensure scene safety, assess patients quickly, and prioritize care based on severity and available resources. Clear communication and coordination with other emergency responders are critical. Remaining calm and adaptable allows effective decision-making. Structured response procedures help manage chaos, maximize patient survival, and ensure efficient use of personnel and equipment. 19. How do you handle conflicts with coworkers? I handle conflict professionally by addressing issues calmly and respectfully. I focus on patient care and teamwork rather than personal differences. Open communication helps resolve misunderstandings, and I'm willing to listen to different perspectives. If necessary, I involve a supervisor to ensure fair resolution. Maintaining a positive working environment is essential in emergency services, as strong teamwork directly impacts safety and patient outcomes. 20. How you adapt to changing protocols or guidelines. I adapt to changing protocols by reviewing updates carefully and attending required training sessions. I ask questions to ensure full understanding and apply changes consistently in practice. Emergency medicine evolves rapidly, so flexibility and continuous learning are essential. Adapting quickly helps maintain compliance, safety, and quality of care. Staying informed ensures I provide evidence-based treatment aligned with current medical standards. 21. How you manage stress outside of work. I manage stress outside of work by maintaining a healthy work-life balance through exercise, hobbies, and spending time with family or friends. I also use relaxation techniques and peer support when needed. Managing stress effectively helps prevent burnout and supports long-term mental health. Taking care of my well-being allows me to remain focused, resilient, and emotionally available while performing demanding paramedic duties. 22. What qualities make a good paramedic? A good paramedic is calm under pressure, compassionate, and highly skilled. Strong communication, teamwork, and decision-making abilities are essential. Attention to detail and ethical judgment ensure patient safety and professionalism. Adaptability and continuous learning help paramedics handle evolving medical challenges. A commitment to service and emotional resilience enables paramedics to perform effectively while supporting patients and colleagues in difficult situations. 23. How do you handle critical decision-making? I handle critical decision-making by relying on training, protocols, and thorough patient assessment. I gather key information quickly and consider potential outcomes before acting. Clear communication with team members supports coordinated care. I remain calm and focused, even under pressure. Effective decision-making ensures timely interventions and improves patient outcomes during life-threatening emergencies. 24. How do you handle patient refusals of care? I handle refusals of care by ensuring the patient has decision-making capacity and fully understands the risks and consequences. I explain options clearly, answer questions, and respect patient autonomy. If refusal continues, I document the situation thoroughly according to protocol. Clear communication and documentation protect both the patient and the medical team while maintaining ethical and legal standards. 25. Where do you see yourself in 5 years as a paramedic? In 5 years, I see myself as an experienced paramedic with advanced clinical skills and leadership responsibilities. I hope to mentor new paramedics, pursue specialized certifications, or advance into a supervisory or educator role. My goal is to continue providing high-quality emergency care while contributing positively to my organization and the community through professionalism, training, and service excellence. Paramedic interviews evaluate clinical knowledge, emotional resilience, communication, and professionalism. Preparing consistent, detailed answers helps demonstrate readiness for the demands of emergency medical services. Emphasizing teamwork, patient safety, adaptability, and ethical practice strengthens your candidacy. With thorough preparation and confidence, you can present yourself as a capable and compassionate paramedic ready to serve the community effectively.